Hey, this is Dr. Lance Hamilton. I'm coming to you today from Jolie Vie Aesthetics. I'd like to talk to you today about female urinary incontinence. There's several different types of female urinary incontinence, one of which is urge urinary incontinence. It's where the bladder tone is too tight. Essentially, the bladder stays hyperactive and you feel as though you have to urinate every 5 minutes. And it really interferes with your lifestyle and is an embarrassment. We have treatments for that, which currently are pills like Myrbetriq and Detrol that do relax the tone of the urinary bladder, and those can be quite effective in treating that type of urinary incontinence. But there's another kind of urinary incontinence that's more difficult to treat, and it's stress urinary incontinence. It's the type of urinary incontinence where if you sneeze or cough, you lose bladder control. And it can get so severe in some people that as they age, they can just stand up and urinate. As people get older, this becomes more and more of a natural problem due to decreased pelvic floor strength. Now, put it in plain terms, it's this. The muscles of the floor of your pelvis weaken as you get older. The tissues thin, and that's why a great number of females have problems with stress urinary incontinence, where they can just cough or sneeze and lose control. In the past, the treatments have been pills, which don't work because the pills were created to treat the urge urinary incontinence, and they don't work good for the stress urinary incontinence. There have been surgical procedures performed to try to help women with stress urinary incontinence, but they have had a lot of complications. In the past, they have done bladder slings, where they will go in and surgically maneuver the bladder so that it functioned better, but there are complications with that procedure where females can be left with decreased sensation in the vagina. There's also been procedures performed in the past where they've used a mesh to perform the same procedure, and the mesh would get complications, and females would get a great deal of pain with sex, pain with urination, and sometimes even have infections in that material and cause worse problems than the person had when they started. I've had patients develop problems where they couldn't urinate at all and had to have a Foley catheter placed permanently due to complications from those procedures. We have also people that have a combination of the urge urinary incontinence and the stress urinary incontinence. And again, the pills will help the bladder tone, but it doesn't do anything for the problem of coughing and sneezing or standing up and losing your control of your urine. So we have something new now. It's called the O-Shot. It was developed by an internist in southern Alabama next to Mobile, Fairhope, Alabama. And he is the same physician that invented the vampire facelift. The procedure involves us taking your blood and we spin it in a centrifuge, just like they do in hospital labs. The tube is specially made so that it's sterile on the inside, so that we can take the serum that's been spun down and put it back into your body without you having any complications. When this blood is spun down, it will be separated in two halves. One half will be red blood cells and white blood cells, and then there's a coating in between that serves as a buffer, and the top coat left in the tube is your own plasma and platelets. Now, platelets are tiny particles in your blood that help you clot. When you cut yourself or skin your knee or scrape yourself, The platelets are responsible for immediately plugging the holes. They go in, they attach themselves to the frayed areas of torn vessels, and they immediately start sending out chemical signals to stem cells in the area to come in and start building what's called fibrin. Basically, that's knitting. And these stem cells will come in and build collagen and fibrin to build a plug and then a scab. So if you've ever scabbed your knee and you look at the scab that's on there, that all started with a platelet plug, and then after stem cells were called up, that's what created the scab that then let your body heal underneath that wound. We have developed a way of using your own platelets to call up your own stem cells to do many other things. In orthopedics, for years, it has been used to help heal wounds that were previously unhealable, where they would actually take this platelet-rich plasma and put it into wounds and they would start to heal, whereas previously they would not. We have started using this in treating people who have arthritis in their knees and shoulders and bursitis. We inject it into those joints and bursa, and it calls up the stem cells and not only reduces inflammation but also helps start building new tissue. So that's old technology using this revolutionary method of calling up your own stem cells. Well, in cosmetics, Dr. Runnels started using the platelet-rich plasma to do facelifts, and it's been very successful. Well, he also developed a way to take the platelet-rich plasma and to inject it beneath a female urethra so that it would build new tissue, which would include new blood tissue, nervous tissue, fibrous tissue, to help strengthen the pelvic floor underneath the urethra. And what that does is it starts helping the main problem that females have with stress, urinary incontinence. It helps to tighten the valve. So whereas pills in the past never did it, and people would take them and just get a dry mouth or sometimes even psychosis and pass out, this procedure uses your own blood and platelets. It is injected back into your body and it calls up your stem cells to come into a space that over time has thinned, and it starts thickening it. And within 3 months, this tissue can form and start helping to help the bladder valve function better. Now, statistics show it has an 80% success rate. And considering that your alternatives are surgery, as I spoke of previously, where you can get infections or complications such as vaginal pain or urinary pain, pain with sex, and sometimes permanent dysfunction of the bladder such that you have to have a Foley catheter placed from then on. This is a lot better option. There's no downside to it because it's using your own serum and platelets. So there's not really any complications. We're just taking a piece of you and putting it into a place where it currently is not being activated. And we're activating it to get it to functionally give you a new bladder valve. So if you would like more information on that, we'd like you to come in and have a consultation with me and I'll discuss it more with you. You can also come in and get a book which explains it further. And we'll also provide a link on our website which can take you to Dr. Runnels' website where he has other videos that talk about it even more. So if you will make an appointment, you can come in and talk to me, or you can click on the links that are provided to either take you to his website or other websites that can explain it more and show more videos. But don't wait, because you don't need to suffer anymore. We have ways of taking care of this problem now that we did not have before. So thank you.